I'm Dr. Erica Bove, and welcome to the Love and Science podcast. I'm your host, and also the founder of Love and Science, Thriving Through Infertility. I'm so excited you're here today. With over a decade of experience helping thousands of women just like you, I empower professional women to build their families with confidence and compassion. Let's dive in. Hello, my love, and welcome back to the Love and Science podcast. Today, we're going to be talking about the day-to-day. We're going to be talking about how to live our lives while we're undergoing this process, this fertility journey. And I don't mean like how to go to work, how to, get your groceries, all those things. I truly mean, how do we live our lives in terms of food, in terms of sex, in terms of travel? What happens if we get sick? What does it mean to be a person undergoing the fertility journey? And how can I really give you some guidance today to be able to say, okay, I'm not going to stress out about this, or, I'm going to trust my body, or, whatever else it is, because I think the question that keeps coming up for me, at least in my own life, is like, am I doing it right? Like when I do something that is maybe out of my wheelhouse, maybe it's a yoga class, maybe it's, I don't know, like something with my clinical job. Like, the question is like, am I doing this right? Am I navigating this in the right way? And the hardest part about the fertility journey is that, those of us type A achieving women are like, well, shoot, if I don't do it right, then the other shoe's going to drop and I'm going to be responsible for this not working. And so, what I'd like to do is give my suggestions on how to live our lives in a way that empowers, in a way that reduces stress, and can just, give some guidance so that you don't have to go down the Google rabbit hole. You don't have to stress out because there's a lot of right ways to do it. And I think, unless we sort of know what does the evidence show, like, then we're kind of lost and feeling disempowered. I've already done episodes on exercise and sleep. So we'll put those in the show notes if you want to refer back to them, because clearly sleep and exercise are part of daily life. And we do need to know how to approach those things if we're going to, feel like our best selves and be able to navigate this process with ease and, and power. But I can't tell you, both when I wear my clinical hat and my coaching hat, I get so many questions about diet and sex and travel and all those things. And so let me sort of give my thoughts sort of one by one about those topics to really think about, okay, how can we live our lives in a way that, feels good, doesn't take away our joy, and, does not compromise the success of the IVF cycle. All right, where do we start? Let's talk about food. People ask me all the time, like, what should I be eating? What shouldn't I be eating? And, the hard part about this question is it really is, not a one size fits all endeavor. I think that there are clearly some fertility diagnoses where we do know that there are certain foods that seem to help, certain foods that maybe make it harder to maintain weight or even, lose weight, all those things. But in general, I think diet is a very individual endeavor. And if you actually look at it, there are studies, people have looked at this, but there's not really been one conclusive diet, so to speak. And I hate that word. I think nutrition plan is a um, much better phrase to use than a diet. But there's, different things that people have tried, Mediterranean diet options, sort of whole foods, looking at keto, even, anti-inflammatory diets. I don't even know what that means. I've researched it. I don't even know. But I think that, when things are not working, especially, and I'll tell you, the people who find me to work with me as my coaching client, these are generally people for whom traditional treatments, traditional IVF is not working. And it's like, what am I missing? Is it my diet? Is it my, you know, uh, sleep? Is it sex? Like whatever it is, people are looking to what they are doing in their own lives and subtly blaming themselves, actually. And so are there any data to suggest that a certain diet is going to have superior outcomes than another? There really isn't. And so let's talk about PCOS for a second. If you have a diagnosis of PCOS, this basically can be associated with insulin resistance, even if your A1C is normal. And so people do talk about, thinking about, diets, nutrition plans that are higher in protein and lower in simple carbohydrates. If people do have carbohydrates, make it be complex carbohydrates, because the thing about simple carbohydrates is that they're just stored so inefficiently that nutritionally they offer very little. And, especially when there can be foods with high glycemic indices that can then promote, insulin resistance and kind of promote those cycles. And so, if you're thinking about, oh, I have PCOS, even if it's lean PCOS, and I'm like really struggling with what I should and shouldn't eat, really like whole foods are great. Avoiding the things that are on the inside of the grocery store aisles, like processed foods, white bread, white rice, a lot of the processed cereals and things, and really thinking about eating more on the perimeter. And of course, it's more expensive, but most of the people who are my listeners who really are on this fertility journey and want to do it. Most of my listeners, fortunately, do have the resources to be able to funnel them in the direction of healthy foods and good choices. So avoid the processed things. There's so many chemicals in them, especially for PCOS. They're not very nutritionally helpful and probably may kind of kick off the positive feedback loops of insulin resistance and inflammation that are not so helpful. Again, everything in moderation, 80-20. Don't kill yourself if you have like a piece of pizza on a Friday night. This is not what this is about. This is just to say, in general, what are the foods that are going to be most helpful with PCOS? And it's probably going to be avoiding those simple carbohydrates for the most part, and focusing on complex carbs and good fats and high protein. Endometriosis, I am a person, and I know this hasn't yet been completely proven, but I do believe that endometriosis is probably on the spectrum of autoimmune disease. And there's something about people with endometriosis, understanding that not all endometriosis is the same, but most of us have retrograde menstruation, where we menstruate out the fallopian tube, because we see this in laparoscopy all the time. But what is it about endometriosis in some people where there's menstrual blood in the pelvis? I think it's that the body just isn't clearing that menstrual blood, and then it hangs out in the pelvis. It creates inflammation. The body tries to, rush as if we've like cut our arm, right? It's an injury. It's a foreign body, so to speak. And then that starts, the cycle of like scarring, things getting stuck to each other, et cetera. So, I do think that endometriosis probably has an autoimmune component, or at least some people with it do. And so then people are like, okay, well, I know that's not been proven, but like, let's do this severe elimination diet and see what happens. In my experience, elimination diets just truly make things more complicated and really just stress people out. So, I am much more a believer in intuitive eating. And it's really hard because I can't give you an RCT, but I will tell you that we are not taught how to listen to our bodies. We are not taught to listen to our hunger cues. We are not taught to listen to our satiety cues. Many of us, hands up, even though you can't see my face, engage in emotional eating at times, especially if it's not like I don't do cooking, right? But like sometimes I go and get a milkshake, like, so I think that we have to really look at the big picture and say, okay, like, what are we trying to accomplish with the food? Food is fuel. We know that whole foods are helpful. And, for each person, the foods that make them feel good and strong and powerful, that might look different for every single person. So, fortunately, in my 30s, I discovered that pizza is not a good food for me. And if I have a piece of pizza, even though it sounds like a good idea, I will feel like I've swallowed a brick for like 3 days, which makes no logical sense in terms of digestion. But it does something to me that is not great. Same with white pasta, same with white rice. Like all those foods have no benefit. And I mean, I think, type 2 diabetes runs in my family, PCOS runs in my family. At one point I was diagnosed with that way back when. And so, I think that, have to think about the nutritional side of things. Yes, like perhaps for me, there's something biochemical about my body not liking those foods. But I can also tell you on the flip side, as I pay attention to the foods that I eat and what makes me feel powerful and energetic and light, a handful of almonds is like the most amazing thing ever. And so, those of you who know me personally know that ever since my residency days, I have just like traveled around with a handful of almonds, like, a packet of almonds, even in my back pocket. You never know when a C-section is going to get called. Like you got to have the almonds. So, I love the protein in the almonds. It makes me feel super powerful. I love fruits. Again, I'm fortunate that I am able to have those foods, at my disposal, but For me, intuitive eating involves like listening to my body and realizing that there are some foods that make me feel amazing and some that make me feel terrible. And in my experience, I think we really have to listen to that as it pertains to the fertility journey, especially in the era of we know that not one diet is going to serve everybody. And what works for one person may not work for another. And so let's sort of throw out this idea that there is a right way to eat during IVF or fertility treatments and say, like, what does my body need? When do I feel the best? When do I feel the worst? And do more of those things. And, of course, hydration is important. Of course, rest is important, but I do think that, like, even trying to eat a little bit slowly and enjoy the food we put in our mouths and, wonder one of the complaints I hear the most often is, gosh, like I've just gained so much weight in these fertility treatments. And, I think part of it is the hormones. The hormones do influence how our body metabolizes food and our hunger cues and all of that. So I think the more we can pay attention to our bodies, the better of effect it will have on, not just how we feel on a day-to-day basis, but then how we feel in the overall journey as pertains to our bodies and, our muscle and our fuel and all those things. So that's my perspective on food. I think there's many right ways to do it, but just pay attention and listen. And if you don't know how to do this, please let me know personally. I would love to have a call with you. It's one of my favorite things to coach on is intuitive eating. And so there are so many like ways through the prison that so many of us have found ourselves in the past. And I just hope this is an empowering message because there are so many ways to do it right. And I'd love to help you figure that out. So that is food in a nutshell. Let's talk about alcohol. It's not sort of a major thing, but people do ask me, like, when can I drink? When can I drink? I think of like, as we are thinking about food and alcohol, et cetera, like if the point of the fertility journey is to be a pregnant person, I try to say, like, are my habits today in line with what they would look like if I were like in my first trimester or third trimester, or whatever that is? So, if there are certain foods that they have like a heavy mercury content, or, like you like to eat a lot of unpasteurized cheeses or things like that. I'm not saying just look at the alcohol. I'm saying like think about what a pre-pregnancy diet looks like and start to think about yourself in that way to prepare your body for hopefully what's to come. So I think about alcohol in that way. Like if you're a person who really relies on wine for stress reduction and your typical is 2 to 3 glasses of wine every night, maybe look at that and say, huh, if I happen to be pregnant right now or this next transfer works, like, would that, how would my evenings look? Like, would I freak out because I miss wine so much? I know lots of people in my own life who've like lost weight in their first trimester because they didn't really equate for how much wine they were drinking. So I think about it and just say, okay, what would this look like as a pregnant person? And, not that you have to like abstain from alcohol altogether. If you have a wedding or, you're out to dinner, even the Surgeon General just came out and sort of said that alcohol is linked to 7 different kinds of cancer. So we're rethinking a lot of things, but really, alcohol in moderation, if it's a time in your cycle when you wouldn't be pregnant, right? Like, it's like the follicular phase of, you're not, that you're not pregnant. I would say in the luteal phase, really to avoid alcohol because it's possible that you could be pregnant. I mean, people say, oh, I have a wedding or whatever. Like, again, use your best judgment. Um, Alcohol in moderation, I do mean there's no safe amount in pregnancy, but, I'm not saying that you have to take all the joy away, but just sort of be thoughtful about it because I think that people who at baseline have, a lot of alcohol in their lives, it can be hard to find something to replace that. If you're thinking about an IVF cycle, like when can you have alcohol, when not? Like the follicular phase is when you're growing the follicles and doing the meds. And so really the only day in that stimulation when you shouldn't have alcohol is the day of the retrieval because you're getting anesthesia. And those two, as you guys know, most of my listeners are physician women. Those two don't mix very well together. And then, of course, if you're in an embryo transfer cycle, and then like from the transfer time on, don't have any alcohol because you might be pregnant. But those are my thoughts about alcohol consumption. I think, use your common sense, even though it's hard sometimes, imagine yourself as a pregnant person and then do your best. Okay. Let's talk about sexual activity during the fertility journey. This is one of my biggest pet peeves as an REI because all the time I'm like, rush, 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 have sex, you're ovulating, or wait, 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 your husband needs to provide a sperm sample, or, you're having a retrieval. What if we leave a couple eggs inside? Like, you don't want multiple gestation, like all those things. Like, I think that having a healthy sex life is very important. And I also think that this process kills the joy out of so much of what could actually be enjoyed. And so, really, like when you look at the sheets that most REI clinics give you and say, like, no sex until you get your period, you're like, wait, I have to go a month without having sex. Okay. So, first of all, I would say there's many ways to be intimate, and they do not always involve, sort of sperm exposure to possible eggs, penis, and vagina intercourse. Like, there are many other ways to be intimate. So I just want to start there by saying I think sometimes we can get very tunnel vision in terms of like what is a healthy sexual life, sexual experience, and a lot of it is just so much more broad than that. So the first thing is to broaden your idea about what counts as intimacy and to use your imagination. If you think about it physiologically, the sperm live in the female reproductive tract for about 3 to 5 days, right? After they are deposited, let's just say, in the vagina. And so, the shelf life of the egg is a lot sooner. It's like a lot shorter. It's like 12 to 24 hours. And so if you think about it, like, if your egg retrieval is on like, you know, day 14 of medications and it's your first week of the IVF cycle and your ovaries are still small, I mean, you know, I don't mean to be a purist in the sense, like you can probably live your lives a little bit, especially if, not too much is happening yet, right? But really that second week of stimulation where if there were sperm inside, and they made it in and then miraculously had a conception and then had an embryo transfer, like, you know I'm all for pregnancies, but I think sometimes if your goal is to really have a successful IVF cycle, just being pure about it in that way, like that second week of stimulation and then from an embryo transfer, around the time of the embryo transfer on, like, I mean, I think it's helpful to just try to minimize the chance of multiple gestation in that regard. So what I tell my patients is like, the second week of stimulation on, like, abstain, because I think that does increase the chances of one baby at a time. And then, even if you think about it physiologically, like the ovaries are big at that point. After the retrieval, they are big. They've gone through a lot. They've gotten poked a bunch of times with the needle, and they're getting back to size. And so, that is that time when I say, okay, at least for the first week after the retrieval, like really just like let your body calm down. There's many ways to be intimate, but like if you think about penetrative intercourse, at least, the ovaries literally sit right at the top of the vagina, which is how we access them for egg retrievals, like I just this morning, an egg retrieval. And so you really have to think about the potential trauma to a fragile ovary and not wanting to rupture an ovary. And so this is not to scare anybody, but it's just to say that, like, if you think about if the ovaries are biggest the week leading up until the retrieval and then the week after the retrieval, that's kind of the time to be very gentle in that area because you really don't want to rupture an ovary with trauma. That having been said, intimacy is fine. So please do enjoy your partners. It's just, really being mindful of what's going on in that space and being gentle to the ovaries. Do people really have to wait until their period comes to resume, activity again? This is kind of like the exercise episode where I said that we just don't really listen to our bodies. And so, like, if you start to be with your partner and something doesn't hurt, then stop, right? I think we got to listen to our bodies more. That's sort of the tagline of this episode is like, listen to your body because your body will tell you. And it is really important to me that you are able to maintain joy, spontaneity, pleasure during all of this, and that we don't just reduce sex to, you know, give me some sperm. We're going to put the sperm with the eggs. We're going to make this very mechanical, or say you're doing ovulation induction, have sex now. Like, I think we really need to remember kind of the bigger picture and the full context of having a healthy sexual life. And if you have questions about this, feel free to reach out. But I think there's more options than we realize at the outset. And if we can use our brains and think with common sense, then and understand why the recommendations are what they are from your REI, then we don't have to live in a prison of just being told when to do things with our bodies when that's just not really spontaneous or natural or fun. So that's my perspective on sexual activity. I hope you found that helpful. I will say, it is March at the time of this recording, and this winter has been absolutely awful for illnesses, flu, COVID, unspecified viruses, URI, norovirus, all the things. I can't tell you how many questions I've gotten about like, I'm sick during this long-awaited IVF cycle. Like, what should I do? Does it affect egg quality? What I can tell you is that it can affect sperm quality for sure. Like, it has been documented and studied that men who have high fevers can definitely see a temporary decrease in their sperm. And any change in sperm stuff is going to take, 3 months to kind of resolve. And so, that is really true that there can be effects on sperm in the context of a virus. But the good news is, I mean, for IVF, especially, like all we really need is one good sperm per egg. And so, if you think about it, most men produce millions and millions of sperm. And so, I would not halt an IVF cycle for the sake of a male virus. I just actually talked with our lab director the other day about this. And yes, there are some viruses that, sort of get beyond all the filters in the lab. But that presumes that there's virus in the semen in the first place. And a lot of the filters that they use for concentrating and purifying the sperm, they actually they do use an actual filter that does weed out a lot of the viruses as well, which is, another, if we think about other infectious diseases like, HIV and hepatitis and those sorts of things, like we know that those things help reduce the viral load, et cetera. So, what I would say is for male viruses, I wouldn't stop the show. For female illnesses, like it's a little different because the female is the one who's going to be undergoing anesthesia, and sometimes anesthesia gets a little bit nervous about putting somebody under, especially if it's an outpatient facility. And so, I don't know. I mean, it's always so tricky. Like if you started your stimulation medications, I feel like this is a very nuanced conversation with your REI. Like, how bad is the illness? Do you have a fever? Do you expect to still be ill, very ill at the time of the egg retrieval? Is it day 2 of your stimulation and the goal is, hope is that you'll be better by like the second week of stim, in which case, if you're 42 years old and you've long awaited the stimulation, maybe it's best to keep going. And so, I don't know. I think that this really does require a tailored approach. I have certainly, done stimulations for people who had mild URIs and they were fine. And sometimes things happen. Like, I remember a few weeks ago, I was doing a retrieval on somebody whose partner had norovirus, and like how were we to know that was going to happen? We didn't know until she really showed up and like stayed out because she, had some pains and some, GI symptoms. But the patient, her wife was fine, and we proceeded, and it was, it really was fine. But sometimes there are question marks like, is there going to be evolving norovirus, et cetera? You just do your best with hand hygiene, and hopefully the eggs are good, and hopefully the embryos progress and all those things. But again, I think we have to use our common sense and take it on a case by case basis. But I don't think that all illnesses require an immediate halting of the IVF process. So that's my thought on illness. I probably will actually record a separate episode on measles since I know that's been coming up more and more lately. But lastly, I just wanted to touch upon travel. I think you're hearing from me now that I am very passionate about people not feeling like they're in a prison of their IVF cycles. And so, like, so much of the time I hear my family has a trip planned in April, but like, I don't know, like, my clinic offered me that date and I'm not sure. And, I don't want to be that much older when I do this thing. And, I will tell you, like, I don't tend to see clinically meaningful changes in IVF outcomes, in egg reserve parameters, et cetera, in any less than 6 months of time. So, say here we are, it's March, say somebody has a trip in June, it's a big trip, say they're going to Europe or something, and they really don't want to cancel that trip for the sake of IVF. Like, I think it's very reasonable to wait until July to have an IVF cycle because the parameters are going to be very similar. And then, you can have your fun, then do your family building stuff. Even if you want to do banking cycles, like that's fine too. But I think so much of the time we think like, we get this message like, I cannot live my life because I want this cycle to work so well, or I have to do it now. And, I would argue like, if we look back on this period of our lives and just think of it as a time that was devoid of joy, devoid of pleasure, devoid of anything to look forward to other than the next retrieval, the next data, that's a very miserable way to live. And so you deserve the joy, you deserve the pleasure. I promise you, there's not going to be any meaningful change if you push out an IVF cycle by, a couple of months. And so plan the trip, plan fun things. Sure, if you want to buy refundable tickets, do that in case you decide in a very empowered way to, swap out a trip for an IVF cycle, but then make sure you get to go on that trip, right? So I think we need to plan travel in advance for our own sanity. And I would also say that like, if you do have like a conference or something else where what the dates are, like clearly during the 2 weeks of IVF stimulation, you really do kind of need to be within helicoptering of your clinic so that sometimes you're coming in on treatment day 6 and they're like, oh, come in tomorrow. Like you really do need that flexibility during that time to be able to come in for appointments. But what I would say is, other than the 2 weeks of the IVF itself, and maybe a couple days after that to just make sure there's no complications, or the time kind of after an embryo transfer when you're kind of in that waiting to see if you have good rising betas or, an injury during pregnancy. I remember one time I had a patient who truly, like, she was newly pregnant and then she had a pregnancy of unknown location and she went to the Arctic tundra. And I seriously lost sleep over that because I was like, please do not do that. Do not go to the Arctic tundra and the polar bears where nobody could save your life if you had an ectopic. So again, I think you have to think, okay, where's the travel to? If I do travel, am I in a place where I could get good medical care? Please don't go to the third world during this time. That's not good. But like I said, like other than the 2 weeks of the stimulation, a couple of days after that, and then, that waiting period from having an embryo transfer to kind of understanding. And I would say like the 6 to 7 weeks of pregnancy mark is kind of like, that's really, if you have to go on a trip the day after your embryo transfer, there's not going to be any badness that happens like in that window. But it's really kind of really trying to establish pregnancy location in the time because even IVF, 1 to 2% of pregnancies end in ectopic. And so you just want to be able to be close to your clinic if you needed to. And again, the more flexible the travel can be, the better. And, even recently, a client told me, you know what, I always go to this conference. I'm a big presence. I'm on the leadership track, but I did say to them, like, I'm having, a health issue right now and I can't come. And I also think we have to give ourselves more permission to say those things at times. Like, sure, if you want to prioritize the conference, go to the conference. But if you want to prioritize hunkering down, staying close to your clinic, keeping the stress on the lower side, give yourself permission. Like I say, if it was an appendicitis, you'd be out. So I don't know why we think of this process any differently. Um, and those are my thoughts about travel. So I hope you found this helpful. We can certainly do more in this series. If there's more sort of questions about how do I live my life, we didn't even get into like plastics and, using glass preferentially and all those sorts of clean living type things. But I do think that by reviewing, food, alcohol, sex, sickness, travel, hopefully this will give you a guide so that you can live your life in a less stressful way because you're not second guessing yourself and you have some guidance from me who has been doing this over a decade and can help you just with some of those choices that might otherwise plague you. So with that, I love you. And until the next time, talk to you soon. Bye.
Thank you for listening to the Love and Science podcast. I'm so glad you joined us today. If you found this conversation valuable, if you could please rate, review, and share this podcast with your trusted people, it would mean so much to me. If you want more tools to help you navigate the fertility journey, please book a discovery call with me today. The link is in the show notes. Please do not let infertility have the final word. I'm here to take the burden from you so that you can achieve your goal of building your family. In gratitude, this is Dr. Erica Bove. I'm rooting for you always.